In this session, we will focus on burnout and compassion fatigue in the pet sitting industry. Professional pet sitting or dog walking are such wonderful career options. And there's no question that there are so many benefits of owning and operating your own business and being able to pursue your passion for pets. But because it is such a great career, I think we often shy away from talking about some of the less than glamorous aspects of pet sitting. And the topics of burnout and compassion fatigue are not the most popular things to talk about, but they are real issues that those in this industry have to face. The good news is that burnout and compassion fatigue can possibly be prevented, and if not prevented, still managed and recovered from to ensure that you can have many, many happy and successful years as a professional pet sitter or dog walker. Before we go any further, I do want to share this disclaimer that you see here on the screen. Many of the tips we will discuss today can help you prevent burnout or work through compassion fatigue, but keep in mind this presentation does not provide or replace advice from a healthcare or mental health care professional. So if your symptoms are not manageable, consult an expert. In this session, we'll cover the two main points you see here on the screen. At the end of this session, you should have a clearer understanding of what both compassion fatigue and burnout are and how they differ. And you'll also be able to recognize the signs of burnout and compassion fatigue in yourself and in others. I do want to share just a bit about myself before we jump into today's topic to give you a better idea of what my background is and also why this topic is a real passion of mine. I've been in the pet sitting industry and with Pet Sitters International since 2004. So this year marks 20 years. I started in the member services department at PSI and have been in a variety of roles over the past 2 decades. But most recently, I have been the president here at Pet Sitters International since 2020. I have been fortunate to meet and work with so many amazing pet sitting and dog walking business owners over the years. But also during this time, I met so many wonderful pet care professionals who experienced burnout or compassion fatigue, and many ultimately left the industry. I remember, gosh, it was many, many years ago when I first started hearing the topic of compassion fatigue discussed in our industry, and the conversations just seemed so hopeless. And I thought there has got to be something we can do. And I don't want to see passionate, caring, highly trained pet sitters and dog walkers leave this industry. Pet parents need you. Pets need you. So I began researching the topic more. This eventually led to me obtaining my certifications as a compassion fatigue educator and a compassion fatigue therapist in 2018. Then outside of PSI, I'm married with 3 children, 2 grandchildren, 3 dogs, and 3 cats, so I stay busy. And then in my free time, you'll find me with my family, maybe at the gym, although I've been slacking on that lately, and then maybe at church, and then we love to hike. I mention all these things because as we discuss compassion fatigue and burnout, you'll see how those elements, our personal relationships, our hobbies, and our activities really come into play. Now let's get started. As I mentioned, in this session, we're going to discuss what compassion fatigue and burnout are and how we can recognize the signs of compassion fatigue and burnout. I think most of us may already be familiar with the term compassion fatigue. But here on this slide, or which you see on the screen, it provides the detailed definition from the Figley Institute. Compassion fatigue is still a relatively new concept in many ways, and it refers to the emotional and physical exhaustion that can affect those in caregiving professions over time. There are many negative side effects of compassion fatigue that we're going to discuss in just a few moments, but as this definition on the screen points out in the last line, the scary thing to me about compassion fatigue is that it ultimately attacks the very core of what caused you to get into a caregiving industry to begin with. Your empathy and compassion for others, and in our case, specifically our empathy and compassion for pets and their people. Now, we do also want to quickly mention and discuss burnout. I often find that the lines are blurred between burnout and compassion fatigue, and certainly there are some similarities, and a lot of the symptoms we'll discuss could go back to either, but there is an easy way to remember the difference, and it's this. Burnout is typically associated with where you work and your specific working conditions. So if you're at a job where you're working long hours, your workload is too great, you feel unappreciated, you don't feel like you're being treated fairly, maybe by your boss, maybe you don't have a good relationship with your coworkers, or the job does not line up with your values, you may experience burnout. But if you were to leave that job, or you were to change the specific working conditions, you would be able to leave the burnout. Burnout is really an interesting topic for pet sitters because most of you own your business and are your own bosses. But that doesn't mean you can't suffer burnout. In fact, I would say that being your own boss may be one of the primary reasons that I see so many pet sitters who are experiencing burnout. Often those who are self-employed are their own worst bosses. You make yourself work unreasonably long hours. You take on too great of a workload. Ultimately, you feel like you have no control over your schedule. Depending on how you set your prices, you may feel that you're underpaid for the effort that you put in. So fortunately, as your own boss, you can change those factors and reduce your burnout as well. But whether you have another boss or you are your own boss, when we look at the definition of burnout, it results from your specific working conditions. On the other hand, compassion fatigue isn't about where you work or what those specific working conditions are. It is associated with the type of work you do. Compassion fatigue is often called the cost of caring, or even the caregiver's PTSD. And it's a natural consequence of many helping professions, such as animal welfare workers, law enforcement, firefighters, therapists, doctors, nurses, social workers, veterinarians, and all others in helping or caregiving roles. And I think that can certainly include pet sitters and dog walkers. I'm sure that you can attest that because of you work with or care for animals, you have likely witnessed, heard about, or experienced traumatic situations in the course of your career. Since we're virtual, I can't have you raise your hands, but I want you to take just a moment and think about examples in your own life of trauma that you may have been exposed to in your work as a pet care professional. I'll give you just a moment to think about that. I'm sure there are several examples that came to your mind. Think sick pets, the death of pets, our human clients experiencing illness or passing away. And while hopefully not often, as a pet sitter or dog walker, you may see the abuse or mistreatment of pets. And then there are also other exposures through volunteer work you may do. If you work with maybe a pet rescue or an animal shelter, for example, your exposure to pet abuse or pet abandonment would be much higher. But as a result of your work, you may witness the trauma of others, and specifically pets. Ongoing exposure to these stressors and these types of trauma can take a heavy toll on our personal lives, our relationships, and our job performance. It affects us mentally, physically, emotionally, and spiritually, and can lead to what we define as compassion fatigue. Compassion fatigue can impact every part of us, from cognitive, emotional, behavioral, interpersonal, physical, and the spiritual parts of ourselves. And so what I want to do to help you be able to better recognize the signs or symptoms of compassion fatigue is to go through each of these areas and discuss the signs of compassion fatigue that fall under each. But first, one of the first signs of compassion fatigue that many people don't know about or that can be overlooked is the loss of sense of humor. I remember when I was training for the compassion fatigue educator certification, and we learned this, and it honestly didn't make sense to me at first. That didn't seem like that would be a telltale sign about compassion fatigue. But once I was tuned into it, I really began to see so many examples in the pet sitters that I work with. Think about some of the things you experience as a pet professional that can be maybe somewhat irritating, but you laugh about them. And it becomes a funny story. Maybe a bizarre request from a client, and you think, I can't believe they would ask me to do that. Or if you've ever had a run-in with a pet accident and a Roomba at a client's home, if you know, you know. But these are things that you may now laugh and think, wow, I have a story to tell my pet sitting friends. But if you find yourself now immediately angry about those things, you're not able to find the humor in them at all, these little quirky requests just make you angry. These could be one of the first signs that you're being impacted by compassion fatigue. Now let's take a look at the other signs. We're going to go through these fairly quickly, but as we do, make note of any of the signs listed that may apply to you. Now, first, let's look at the cognitive symptoms. You may experience diminished concentration, confusion. A big one I see is preoccupation with trauma. You keep replaying those experiences, the sick pet, the pet injury that you witnessed, etc. Some people experience apathy, or they find themselves being very rigid in their thought patterns. Some people have whirling thoughts, and then in more extreme circumstances, thoughts of self-harm or harm to others. There are also emotional symptoms that you may experience. A sense of powerlessness is definitely one. Feeling like you can't change the negative things that you're witnessing. Anxiety. Some people experience anger or rage. A sense of helplessness. Some people become very hypersensitive. You may feel like you're on an emotional roller coaster, or just have that feeling of being just completely overwhelmed or depleted. Pet sitters experiencing compassion fatigue may also see behavioral symptoms. Some of these you see in the list here, they may find themselves feeling impatient, irritable, moody. Maybe they withdraw from others. Some people find themselves being more accident prone or losing things when those weren't things they experienced previously. Sleep disturbances or nightmares are also one that I hear about quite a bit. Also, appetite changes. Some people find themselves being very hypervigilant or using negative coping mechanisms like excessive drinking, smoking, etc. Not surprisingly, compassion fatigue can also impact our interpersonal relationships. You may find yourself isolating from friends, having that sense of just wanting to be withdrawn. Some people report a decreased interest in intimacy or sex. For those who have children, some people know that they feel it has an impact on their parenting. They may be worried about being too aggressive toward their children, or having this overwhelming sense of I have to protect them. That goes back to the hypervigilance we also mentioned. Some people find themselves projecting their anger or blame onto others for the things that they're seeing. They may have a sense of intolerance that they didn't have before, and then loneliness. There can also definitely be physical symptoms such as sweating, rapid heartbeat, breathing difficulties, more aches and pains that you didn't experience before, even dizziness, spells of dizziness. Having an impaired immune system, finding yourself getting sick much more often than you ever did before, and then in extreme situations experiencing physical shock. Now, of course, with any of these symptoms, and particularly this list of physical symptoms, as you know, these can be the result of other things as well. So as I mentioned in the very beginning, you should always consult with the experts, your medical doctor or mental health professional, to rule out other issues as well. And last but not least, many who suffer from compassion fatigue will also experience what we call spiritual symptoms. After witnessing trauma, you may find yourself just really questioning the meaning of life or feeling like a loss of purpose. You had that purpose in what you did in your career, that purpose and why you chose this profession, and maybe you just feel like that's completely gone. Or lack of self-satisfaction. Maybe you once took pride in your work and what you did as a professional pet care provider, but you just find now that you just no longer have that sense of self-satisfaction for what you do and what you're contributing. For those who believe in God or a higher power, they may find themselves feeling angry at God, wondering why he let the things they've witnessed happen. Some people find themselves questioning their prior religious beliefs. And this often goes back to the anger that they feel at a higher power because of the trauma that they have witnessed. Maybe a sense of just listlessness, just being unsatisfied and not where you need to be, or that sense of pervasive hopelessness, that you cannot change the situations that you're witnessing, the circumstances that you've seen in your clients and in their pets. Now, as you can imagine, with this variety of symptoms in the categories we've discussed, compassion fatigue will also ultimately impact your job performance. If not dealt with, compassion fatigue can truly chip away at your performance, your professionalism, and ultimately the reputation and success of your pet sitting business. Signs of compassion fatigue impacting your work performance may include an increase in the number of mistakes you make. Of course, none of us are perfect, but if you find yourself making more mistakes than normal, on the other side, people may find themselves obsessing about the details, going over every little item because they're so afraid of missing a step or making a mistake, even though these are things that they performed regularly. Some people report, may have a decrease in the quality of their work, where their work performance has just become subpar to what they were previously able to accomplish, or they find a decrease in the quantity of their work. Now, certainly all of us need to take a look and make sure we have a realistic workload. But if you have a realistic workload but find that you can no longer achieve that, even though it should be reasonable, that could be a sign that compassion fatigue is affecting your job performance. You may feel low motivation. You simply just don't feel motivated to run your business or perform pet sitting visits. Just that motivation you once had has gone. Avoidance of job tasks. Now, I think all of us have wanted to skip paperwork from time to time, but if there are job tasks that you have to do for your business and you're just finding it nearly impossible to do those now, you just can't make yourself do it, that could be a sign. And then still others find themselves setting just perfectionist standards. Of course, we all want to do an amazing job as pet care business owners, but if you find yourself setting standards that are really just setting yourselves up for failure because you've become so focused on thinking you must be perfect, that could be in response to you trying to control the situation of the trauma that you've witnessed. And so that's another sign that compassion fatigue has started to impact your work performance. Now, as you see on the screen, I want you to be aware of these changes in yourself. But if you have staff sitters, you should also be aware of these types of changes in your team. As an employer, I think there's an ethical obligation to look out for your staff sitters. I've heard from many pet sitting and dog walking business owners over the years maybe complain about some of their team members who used to be the star sitters, and suddenly they appear lazy or they're making mistakes. And often the first assumption is, oh, they just don't care anymore, they've gotten too comfortable in their job, or maybe they're looking for another job. But it's important to be aware that while it could be one of those things, that's certainly a possibility. It could also be that the performance issues are caused by compassion fatigue, and that's something that you can work with your staff sitters to address. So I think as employers, you have an ethical responsibility to train your staff member on this topic. Share this session with them so that they are aware of the signs of compassion fatigue and that they are comfortable coming to you if they have concerns, and that then you're prepared with resources to provide to them that will help them address the compassion fatigue that they're experiencing. Now, we went through this session fairly quickly, but I do encourage you to go back and rewatch this session as needed, review your notes, and do check-ins with yourself, not just today, but on an ongoing basis, so that you can take inventory of any symptoms that you may be experiencing and address those. But before we end this session, let's also do a quick recap. As we've discussed in this session, compassion fatigue is the emotional and physical exhaustion that can affect helping professionals and caregivers over time. It's different from burnout because while burnout is specific to your job location, their specific working conditions, compassion fatigue is a result of the type of work you do. In the pet care industry, we may have chronic exposure to trauma such as caring for sick pets, experiencing the loss of pets, working with the clients who are ill or pass away, and then possibly witnessing pet abuse or neglect. And all of these exposures can contribute to compassion fatigue. And then as we've discussed, the symptoms of compassion fatigue may be cognitive, emotional, behavioral, interpersonal, physical, and spiritual, and they affect us in all aspects of our life because it is a holistic issue. I want to thank you so much for taking time to view this session, but I want to encourage you to please not stop here. This is just part one of a two-part series, so please be sure to watch the second session where we will dive into specific ways you can assess your risk for compassion fatigue and create a plan for self-care.